Welcome to an overview of the Durham Service Collaborative. The Durham Service Collaborative is part of an initiative called Systems Improvement Through Service Collaboratives, or SISCI for short. SISCI is supported by 6 Ontario ministries and is one of 22 initiatives that were rolled out in the first phase of Ontario's 10-year mental health and addiction strategy. The Durham Service Collaborative is one of 18 service collaboratives across the province. The collaborative is made up of service providers from across sectors such as health, education, social services, justice, housing, and others who have come together with youth and families to support the system of services for children and youth with mental health addiction needs in Durham. The collaborative was launched in December 2012 and began by establishing a shared understanding of what the system is, who is being served by the system, and who is falling through the gaps. The collaborative also mapped the service journey for youth and families and identified overarching service gaps and where breakthroughs were needed. In addition, the community has been engaged in a number of ways, including focus groups, consultations, and face-to-face meetings with service providers, youth, parents, and various stakeholders in Durham. This engagement continues and will remain an important source of feedback as the collaborative moves forward. Based on these discussions, the collaborative identified the gap they wanted to address: coordination at the system and individual level. It was commonly agreed that creating any meaningful and lasting change in the gap area would require interagency trust, teamwork and understanding, a holistic approach to assessment, transparency and collaboration, shared processes and accountability, shared training, and coordination at the system and individual level. Based on these discussions, a number of intervention components emerged. Collaborative members agreed that these components should be part of their intervention. Based on the identified gap area and the principles and intervention components, the collaborative developed the Durham Collaboration Framework, or DCFW for short. The Durham Collaboration Framework is made up of several linked elements: the DCFW Oversight Committee, the Durham Collaborative Planning Process and Achievement Plan, the Network of Champions, which is a community of practice, and shared training and education. The DCFW Oversight Committee will provide high-level guidance and support to the DCFW. The Network of Champions is a community of practice made up of agency champions who are the go-to people that support the successful implementation of the DCFW within their agencies. Shared education and training includes region-wide training and workshops related to capacity building and supporting service providers in implementing the DCPP. A key part of the framework is the planning process. The Durham Collaborative Planning Process, or DCPP, is a cross-organization, cross-sector care planning process. It helps children, youth, and families in Durham region who are involved in the mental health and addiction systems, but whose needs are not being met. The DCPP is not a treatment program. It is a way for service providers to coordinate and collaborate. It involves bringing together a community of traditional service providers, non-formal supports, children, youth, and families to collaboratively and creatively find the services and supports that will best meet the needs of the children and youth. This process leads to the development of an achievement plan. The achievement plan describes the overall achievements that the child, youth, or family is working towards and outlines the steps, roles, responsibilities, and timelines that have been agreed upon to meet these achievements. The DCPP helps children, youth, and their families to work together with service providers and other important people in their lives to find creative ways to provide the right services and supports at the right time. A number of principles and values underlie the Durham Collaboration Framework and are integrated into the framework and process. The goals of the framework are to help service providers to better communicate with each other and with children, youth, and their families, to see children and youth as more than a diagnosis and to build on their strengths, to increase the ability of children, youth, and their families to access services that can help them, and to increase the ability of the service system in Durham region to support children, youth, and families with multiple needs. There are a number of agencies involved. We've taken the time to reach out to community members involved with the Durham Collaborative Planning process to hear what they thought about what the future held for Durham region.
I believe strongly that as a community, we have a responsibility to our young people. We have a responsibility to enable them to achieve their own unique success. I see the Durham Collaborative Framework being a key contributor in fulfilling these responsibilities by bringing together and joining the community as a whole beyond the traditional social services sector to support and provide expanded opportunities to young people and their families. This initiative will not only help confirm that positive outcomes are achieved through collaboration, it will also aid in addressing service gaps that are barriers to the success, health, and well-being of children and youth in our community now and in the future. Thank you for this opportunity.
I am so thankful that the Durham Service Collaborative Framework will support youth and families in getting more appropriate holistic care for their children and youth with complex needs versus them being denied services due to their comorbidity and diverse needs. If this collaborative table was enacted prior to my only son Tyler's death at age 19, perhaps he would still be alive. The Durham Service Collaborative process has not only established this collaborative treatment planning table, but it has also increased awareness and sensitivity to all service providers involved in the process. I believe all service providers have an increased desire to think outside the box to meet the growing and changing needs of children, youth, and their families.
The motivation and desire for change in Durham Region is real. We look forward to continuing to work with you as we try to effect real change for children and youth in Durham Region.